My name is Matthew Langford. I am a orthopedic hand and microsurgeon. I am board certified in general orthopedics, as well as having a subspecialty certification in hand surgery. I received my medical degree from Temple University in Philadelphia. I've had several different experiences through the Navy. In my 14-year career Navy before coming here, I did a 1-year general medical officer tour where I was a general practitioner with the Marines in Okinawa, Japan. Got to spend a couple months in South Korea on a training exercise up along the DMZ, which was quite an interesting time. Came back to complete my residency, went out for my 2-year general orthopedic utilization tour in Sicily, Italy. And then after completing my hand fellowship, I then spent 5 years at the Naval Medical Center, Portsmouth, helping to train the residents while also taking care of the local military members in the community. I chose orthopedics because it was an amalgam of different things that I liked. It's very interesting to me, the things that we can do for patients these days, the opportunities that we have to make somebody that 50 years ago would have been crippled can now have a very productive and fulfilling life, being brought back to nearly their baseline activity levels again. If I could change one thing about medical care for patients, I would say it would be to decrease red tape, making it easier for access for patients, for physicians to treat, which I think Genesis does a very good job of trying to facilitate our interactions and making things as easy as possible. My favorite part about being a doctor is being able to help people in need. People tend to come in to, especially an orthopedic clinic, having something hurting them, not being able to do a particular activity in their daily life and wanting help. And for the patients that can be helped, seeing them walk out of clinic with a smile on their face because an injection has helped significantly for that period of time, or after a surgery when something that they couldn't do, they now can. That's why I went into it. In a typical office visit, I would come in, introduce myself, sit down across from the patient so that we're sitting eye to eye, go through a history of what brought the patient in, what's going on, what have they tried, what hasn't worked, what has worked, what are they expecting to, hoping to get out of a visit, and then moving on to a physical exam. In general, we treat things from routine carpal tunnel syndrome to trigger finger, tendon lacerations, nerve lacerations, broken bones, fingers, wrist, forearm, tennis elbow, lateral epicondylitis, to ruptured tendons with a distal bicep rupture. Every patient is important. Every patient counts. And I try to get the maximum improvement for a patient, regardless of whether they are a concert pianist or a manual laborer. Every patient matters the same. And so my bedside manner, I would call attentive, compassionate. I try to listen to what the patients have to say. I try to put that into perspective of where they're coming from and what it is that they are hoping to gain out of seeing me. And I try to throw a little levity in if I can, because sometimes laughter is the best medicine.